Good afternoon. My name is Corina Herrera Loera, Public Information Officer for the Santa Clara County Emergency Operations Center. I am here today to give an update on some of the most recent announcements that our county has made, as well as we have our guest, Dr. Gerardo Cortez, who will be giving us an update on the most recent vaccines, booster shots, and then answering any questions that you might have in regards to what that might be here in our county and what that looks like. So before we bring in Dr. Gerardo Cortez to give an update, I'm going to give a general update for our county. So if I can get the next slide, please. So the most recent numbers that we have here for our COVID-19 daily update in regards to the vaccines is that 89.2% of those that are 12 and older in our county have received at least one vaccine dose, which is great. We are at 84.5% of those that are 12 and older who've completed the vaccination, which means that they got the Johnson, they got one of the doses needed, and if they got the Moderna or Pfizer, they've received both. And then we have 138 new cases, 7-day rolling average here in our county. And in regards to our vaccination rates by race and ethnicity, as I give an update now, and I think, we're doing better. You heard the numbers were in the 80s in regards to Santa Clara County as a whole. But in our Hispanic Latino community, we're still at 72%. And so, we still need to get those numbers up. And if you go to our site, you're able to see any of the breakdowns and go to any of the races or ethnicities that we have on there to see what the updated numbers are. But we are still behind, as you can see in our Hispanic Latino community, at least 10% from that of the entire Santa Clara County population. Next slide, please. And so on this slide, I like to highlight, again, people say, why should I get it if you're still on the fence? Are there any benefits? People are still getting COVID, but, should I get it? Should I not? And so this slide really shows that the cases of COVID, so the current cases that are testing positive for COVID, the vaccination status, those that were vaccinated, fully vaccinated case rates on the right, you'll see the light blue, which is the number, the low number of those that were fully vaccinated and got COVID-19. Now the 25.3, that orange number, the first number, are those that were unvaccinated. So folks that were unvaccinated and got COVID-19. So you'll see the huge difference in the numbers. And another huge difference, and the doctor will, surely, I'm sure, highlight this again, is that the symptoms aren't as severe. So those that had the COVID-19 case vaccination and got COVID-19 and tested positive, their symptoms were not as severe as those that were not vaccinated. And so again, I just want to highlight to our community, if you have any questions about, specifically the vaccination, how it works, our doctor will be answering that. Make sure that, you start putting your questions in the comments. We will have time for questions and answers to have this conversation with the doctor here to answer any of your questions. Next slide, please. And so some of the most recent announcements, big announcements in our county was last week, the indoor masking, the different health, Bay Area health leaders came together and made an announcement in regards to the indoor masking. I know we're all tired of wearing the masks indoors. We can't wait to take it off. And, along with that, we can't wait to be in a safe place at the county level to be able to take them off. And so what does that mean? In regards to our indoor masking here in Santa Clara County, indoor masking will not be required in the public spaces when the jurisdiction reaches the moderate yellow COVID-19 transmission tier as defined by the Center for Disease Control and Prevention, CDC, and remains there for at least 3 weeks, and COVID-19 hospitalizations in the jurisdictions are low and stable in the judgment of the health officer, and 80% of the jurisdiction's total population is fully vaccinated with 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson. Booster doses are not considered in this specific case. Or 8 weeks have passed since the COVID-19 vaccination has been authorized for emergency use by federal and state authorities for the 5 to 11-year-olds. So as you can see here on the right, you'll see where we're at now as a county. And so this is where we're currently at. And so again, this is subject to change depending on the COVID cases, but we do qualify for one of the marks where the jurisdiction reaches a Moderna yellow COVID-19 transmission tier as defined by the Center for Disease Control and Prevention, CDC, and remains there for at least 3 weeks. But notice that it's just for the moderate. So just for that, we're not yet at the point where the hospitalization rates in the jurisdictions are low and stable in the judgment of the health officer, and 80% of the jurisdiction's total population is fully vaccinated with 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson booster doses not considered. So I know that's a whole lot of information. And again, remember, this is live. You can come back to it if you want to, understand it clearly. But just know that currently we are not there yet. We're close and we're getting there. And I know we're all doing our part, but we're not there yet. So we are still, continuing to wear our masks indoors as we've been, instructed to do so. But most importantly, I think on this one, I want to highlight as a parent that nowhere here will you see schools. So what does that mean? That our children will continue to use face masks until there is a different directive. So this doesn't include schools. The CDC, your school, you'll hear a different report back from the schools. So just make sure that your children who are going to schools, daycare, preschool, continue to wear their face masks until you hear otherwise. Again, as we know, our children are in closer contacts, different reasons, and the CDC will make sure to make an announcement when that comes up. I know that was a lot of information, but just I think for now, I think we see the light at the end of the tunnel. We're doing better. Soon, I think we will be able to, not have to wear our face masks indoors of different businesses, etc. And I look forward to the day where my daughter doesn't have to wear her face mask to school because we're all, in a much better place. But for now, that is still the mandate. Nowhere here do we say, no face masks for the school. That will be a different directive from the CDC. Next slide, please. And booster shots. So I'm going to just go over this very generally. And I know the doctor probably has additional updates or, something to add to that. So basically the booster shots, if you are eligible for them, if you received 2 doses of the Pfizer more than 6 months ago, and you are older than 65, or you are 18 to 64 years old and live or work in a long-term care facility, you are 18 to 64 year old and have underlying disease, or you are 18 to 64 years old and work in a high-risk environments. Or you are 18 to 64 years old and live in a high-risk environment. So either work in, live in, have an underlying disease, live or work in a long-term care facility, or you are older than 65. And I'll let the doctor give any additional comments on that. So next slide, please. And these are some sites in the local area here in Santa Clara County that you can go and get your booster. You can get your vaccine. As you can see, no appointment is required. It's free, no insurance is required. So we have Emma Prish Park here in San Jose, open Tuesdays, Wednesdays, and Thursdays, 12 to 7. We have DePaul Health Center in Morgan Hill, and that we have Wednesdays through Fridays, 9 to 6, Saturdays through Sundays, 8 to 5, and Mondays, 9 to 6. Next slide, please. And I'm just highlighting a few different ones in the different areas in our Santa Clara County. So if one is closest to you, you can go there. We have one in Mountain View, the community center, and that's open Tuesdays through Saturdays. And you can call 408-970-2000 for an appointment. You can go there, or you can go also to San Martin Vaccination Clinic, and that's open Tuesdays through Saturdays, 8:30 a.m. through 3:45 p.m. And then the other site that I want to highlight, this next slide, is a site at the Story Road Hub Service Center. And that's there on the corner of Story and King, right next to Cardenas, under a clock there. You can go there Mondays, Tuesdays, and Wednesdays, 10 to 3. It is closed from 11:30 to 1 p.m. So just note that if you get there during that time, you may have to wait for the personnel to come back. And then Fridays, 10 a.m. to 1 p.m. And for that one, you can call the 817-6950. They have testing and the vaccine. They have Fridays from 3 to 7:30 that you can show up, and Saturdays and Sundays from 9 to 4. And for the vaccine, you can call 970-2999 for that site. Or you can always go to the sccfreevax.org site. Next slide, please, where you will see the listing of our entire vaccine sites. If none of these are close to you, you can definitely find one there, and make sure to go. And then also we have the booster shots available, as we know now. So the lines might be a little longer. You want to make an appointment, you can. And then also know, again, for the testing, we do have that available in our county through the www.sccfreetest.org. Next slide, please. And then just, reminding our community, there continues to be COVID-19 resources. If you are, if you end up getting COVID and you do need to access some of our resources, the main number I would just, give to you, and there's many numbers here for different resources, but the 211 number, if you call there and you tell them what your specific need is, then they will direct you to the appropriate county site to address whatever it is that you need. So 211, that's open 24 hours a day, 7 days a week. And then just let them know what your need is, anywhere from, needing food to maybe needing a place to live. If you live with, many people and you cannot isolate. If you are looking for resources around mental health, they'll be able to serve you through that number. Thank you so much. And I think that's our last slide. So Dr. Gerardo Solorio Cortez, welcome back. Thank you for being available to come and speak to our community here on a monthly basis to give us updates and to answer any questions. We want to make sure that we give our community the opportunity to ask questions directly to a doctor who can, make sure that you all get the truth, the information from a doctor, and even maybe clarify any misconceptions of the vaccine or even COVID. And so we appreciate your availability to be available to have this conversation. Do you have any updates for us or anything you want to add?
No, yes. Thank you, Corina. Always happy to be here. Excellent information you gave earlier. So thank you. Yes, again, my name is Dr. Gerardo Solorio Cortez. I am a primary care doctor at Valley Health Center in Gilroy. And yeah, today I think, as I said probably at the last time we were here, as we've been saying, is if whoever hasn't been vaccinated and you do qualify for the vaccine, please get vaccinated. As you mentioned, Corina, specifically for the Latinx community, we're at a 72%, and looking at the general population, hitting almost 85%. So we have 10 percentage points to get there. So if you haven't gotten vaccinated and you qualify, please do so. With regards to the boosters and third vaccines, I think I want to separate it just so that we get the terminology correct in terms of just the information. So in terms of a third vaccine, what the CDC and FDA recommended a few weeks ago already was that for anybody who had received the mRNA type, which include Moderna and Pfizer, they actually recommend a third vaccine, meaning that you got the first, second, you need a third one 28 days after your second vaccine. And the reason why they came to this conclusion is looking at the response of the antibody levels after vaccination. So the studies looked at individuals who didn't have immunosuppressive conditions, such as going through chemotherapy or cancer, or having like, for example, HIV as an immunosuppression condition. They looked at those individuals and people without those diagnoses, and they found out that the antibody levels were lower in that population. So for that reason, anybody who got mRNA vaccine series, they recommended the third vaccine. So the terminology is a little bit different from the booster. When it comes to boosters, as you mentioned, Corina, Pfizer is recommended as a booster at this moment for anybody above the age of 65 years old, or between the ages of 18 to 64 with chronic medical conditions that put them at high risk for severe COVID. For example, history of diabetes, history of hypertension, heart failure. Those would be conditions that would also qualify for a booster Pfizer vaccine. And let me step back a little bit. So this recommendation is 6 months after your second dose. This is different from the third vaccine, as I mentioned, for the patients who are immunosuppressed. That's 28 days after the second dose. For when we're talking about just the technical term booster, and talking specifically of 65 and above, or people with medical problems, we're talking about 6 months after. And as you mentioned, Corina, also individuals that work in high risk areas that expose you to COVID, such as the health industry, even grocery store, that puts you at closer risk to COVID infection. That also allows you to qualify for the Pfizer booster vaccine. And people may be asking, so what's the deal with Moderna? Can I get a Moderna now when we're talking about boosters? At this moment, the recommendation CDC FDA is to wait. I think we're probably a few weeks. Actually, let me step back. I actually got a newsfeed report, and potentially in the next day or week, FDA CDC is going to comment on the Moderna booster. So we just have to wait for that. Same story goes for J&J. There is going to be probably some, and there's been discussion on like mixing vaccines. There are studies being done. For example, let's say somebody who got the Johnson & Johnson vaccine and wants a booster, now, is there the potential to vaccinated with the booster Moderna or Pfizer mRNA technology? And there is some studies going on now, so that will tell us if that is okay or not. And I'll take it a step further. In San Francisco County, actually, for individuals that are going through, for example, chemotherapy and got the J&J vaccine, they're actually allowing to have a booster, Moderna or Pfizer. So I say that only so that you could also, as individuals, you're able to discuss these realities with your healthcare clinician, be it doctor, nurse practitioner, whoever, just so you know. But yes, that is it. Oh, and then lastly, the vaccines for the children, and specifically, I'm talking about 5 years and above. And where there's still studies being done, I think in the next few weeks, maybe in 1 month or two, we'll know. And I'm looking at, it sounds like Pfizer is going to be the company that's looking at having something approved in the next few weeks for ages of 5 years and above. Thank you, Corina.
Thank you, Dr. Solorio Cortez. So we have, a couple questions here. But I want to, before we go to our questions and answers, is confirm or clarify that we currently, here in Santa Clara County, we currently are in a substantial risk, which is why we're still needing to wear our face masks. So we still continue to be in a substantial risk. Looking forward to be, out in the, just out of this, as I mentioned. But when we come out of the substantial risk and we meet some of those criteria that I mentioned, then we'll be able to go into not wearing our masks. So just wanted to clarify that we in Santa Clara County on October 13th are in a substantial risk transmission, not moderate. So I wanted to clarify that. And so I want to start with some of our questions, Doctor. We're going to start with, we have Ro who's wondering, why bother getting a booster if masks are still required?
Always talking about, pandemic, there's different layers of protection. Let's go back months ago, talking about the 6 feet distance, social distancing, the masks, wearing the masks, and now, having shots available in January, that was another layer of protection. So, I mean, the science studies coming out say that, and they actually look at individuals who are wearing a mask, not vaccinated, versus wearing a mask and vaccinated. And the question is there infection, number one? And number two and three, how severe is that infection? Is it, moderate, mild, meaning do you end up in the hospital, or do you have symptoms that, keep you at home? And all that data and all those protective layers tell us that, vaccines and, looking out now on boosters, it's the data coming out. And, who knows, in a few weeks, things change. But at this moment, as Corina was mentioning, is like the data says that a booster is recommended because the studies have looked at the antibody levels, the number of people who become infected, and then we look at percentages. If in January of this year, when they came out in the market, we were looking at 95% protection against any kind of disease, and I'm talking about COVID specifically. And now we're looking at 70s, 80%. So there's some, we call it waning protection, meaning the decrease of protection. So for those reasons, the recommendation is to booster at this moment people who have gotten the Pfizer vaccine.
Thank you, Doctor. And remember, if you have any questions specifically to what we're talking about for Dr. Solorio Cortez, and we have, please put down in the comments. I have a question here from Scott Pearson, who's wondering, why a booster? What do we know now as to when we were told the 2 vaccine shots or one for J&J were enough?
Exactly. And I think, let's step back with even the term, novel, what it means. It's new. It's new to, patient society. And as we go, we learn. And what we're learning is that, and again, looking at the antibody levels, looking at people who become infected with the condition, people that end up in the hospital, and people that unfortunately end up dead. We're looking at all that data and saying that the best shot or at this moment, and let me step back with what Corina mentioned a few minutes ago is when do we take off the mask and all that. I think to get to that, the science evolves, and each day, each month, we learn. So what we said in January, February, yes, it was true for that moment. But as scientists, things change, and it's more of a point of we want to do the best at decreasing harm, which is people becoming infected, and then the other two factors would be um, decreasing the amount of hospitalizations and deaths. And the data right now shows this. And again, through studies, different companies, different universities, different private companies doing their studies and looking at the numbers, we come to this conclusion.
Thank you. And then we have another question for you, Doctor. We have Lori here who's saying, I may need to take a plane trip. This is considered high risk, and I would need to wait until the Moderna booster becomes available before taking this plane trip. I was fully vaccinated with Moderna as of the beginning of May.
Yes, it's a very good excellent question. Thank you, Lori. Um, as we move forward to when to the pandemic, you probably heard of just you know looking at yourself in terms of what risk um, do you have, what risk are you willing to take, um, and that was if you put yourself back in when this all started back in March, April of last year, and now there was a shutdown with just in general, and the answer there was we need to do that for our protection. Now as individuals, we're becoming vaccinated, we're wearing masks, um, the trip, and as Karina has mentioned too, we want to go back to normalcy. So Lori, your trip is I would take all that into consideration. Is what kind of trip is it? Is it essential? Um, Moderna right now, so what is your protection? It's there. The vaccines right now at this moment, they're very effective as in terms of like percentages wise, high percentages, 80s, 90s with when it comes to preventing hospitalizations and death. So that will be an answer to that in terms of being vaccinated with Moderna, and now the infection, just getting infection. You were at 90% back in January. You're probably at 70, 80% now. And that's why, and I get your question, like, do you wait for your trip to get the booster to be at that 95% that you were on in January? And that's a personal choice. And that's why, a few minutes ago, I also mentioned the layers that we all got, meaning the layers of social distancing, the layers of wearing a mask, um, all those, taking those variables, and then also looking at how important that trip is. Hopefully, that, and also having a discussion with your healthcare provider. I think me myself, I'm a primary care doctor, and I get these questions, and we with my patients, I try to work around them and have an informed decision. To for in your case would be to be wait for your booster, or do you take this trip? But excellent question.
Thank you, Doctor. And then we have Mark Peter de Guzman here, who is wondering, my mom recently got a booster shot since she turned 81 years old. I am the only other occupant that resides in the household because I have a form of autism. Should it be recommended that I get a booster shot too?
It's a very good question. I'm sorry. I'm going down my list. So did you get the Pfizer? I would say if you mentioned the history of autism, and I do know, for example, Pfizer booster. Um, one of the conditions is also hypertension, diabetes, and there's also Down syndrome as well. So I think having a discussion with your healthcare clinician, doctor, nurse practitioner, potentially, I think you would be a candidate if it was the Pfizer vaccine.
Thank you, Doctor. And then Lori was just clarifying that it was May, not January, that she was fully vaccinated. So it's been a little.
No. So if I was to answer, so then I mean, it's still actually so. You're if the science says, and we look at your antibody levels, being vaccinated, your antibodies are at a higher level now versus January. So you actually have higher levels.
Okay, thank you. And so just want to remind our audience, if you have any other questions, please feel free to put them in now. Otherwise, I'm going to open it up to the doctor again to give any closing remarks, any closing thoughts to our audience, our community here in Santa Clara County. Remember, we're blessed enough to have him here once a month to be able to answer any questions, clear up any maybe lies that might be being spread that you might believe that you're not sure about, and he's here to either clarify or not, right? And so we're blessed to have you, doctor,
No,
to be available to do
yeah,
this. Yeah, I don't see any more questions. So any closing thoughts for our community today?
yes. As Yeah, I would say reaching the 84%. We just want to thank our community, or the people who have gotten vaccinated. And then I would just say keep your eyes open for our next forum, or as we move forward with the uh, the vaccines for the children. So I think that's the biggest group that's one of the biggest groups that we want to vaccinate, and for sure the county is well prepared, and as you mentioned, the extensive areas or extensive clinics where you could get your vaccine. But no, once again, thank you very much for having me over. Thank you.
Thank you, doctor. And Christy was able to get one final question before before we close here, so I'm going to ask her question and maybe we can close with that. Christy Garrison is wondering, if we had COVID before the lockdown and are fully vaccinated, what is our immunity like?
It's a very good question. Studies so I'm assuming I'm assuming that by COVID, that means that you were positive and infected with COVID, and then you got fully vaccinated. So yes, there's studies being done in that particular patient population, and looking at the antibody levels. And yeah, this what I've read is you're actually having previous infection, and then now adding a shot immunization, your levels do go up even higher than not having the history of infection. So more to come in terms of what science says. But at this moment, we're still recommending vaccine in individuals that have become infected with COVID. The only caveat is that you need to be out of your quarantine, which is usually 10, 21 days, depending on your severity of COVID infection. Thank you.
Great. Thank you so much, doctor. And gosh, we don't leave you off the hook. There's one other question that came in from YouTube. And, I know we have a lot of activity through Facebook, so I'm really happy to also get one from YouTube here. We have Judy Creek, who's wondering, I'm 85 and had my second Moderna vaccine. When can I get a booster?
I'm hoping pretty soon. Like I said, I got a newsfeed article in my phone, and I believe the CDC, FDA are going to talk about it this week next. And that's what it was. The biggest issue was that Pfizer, got their paperwork together, and they submitted their info to the CDC and FDA. And I think Moderna was a little bit late, but they were just a few weeks off. And considering that Pfizer was booster was approved a few days ago, I think it's 2 weeks. I foresee that pretty soon we're going to say Moderna is a go for the booster.
Looking forward to it, as I got the Moderna as well, and I'm looking forward to getting my booster. Thank you so much, Dr. Gerardo Solorio Cortez. Thank you so much, community, for tuning in from Facebook, from YouTube, and sending in your questions. Remember, we're blessed enough to have him here once a month, so look out for him. Next month we should have him back, giving us the most recent updates, hopefully with a lot more good news, especially for those of us that got the Moderna. And for those of us that have babies, for the 5 to 11, hopefully we have good news in about a month is what we're hoping for. Thank you so much for tuning in, and we look forward to seeing you here on our In Conversation with the County every other week, and In Conversation with our doctor every month. Hope you all have a great evening. Take care.